Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here in Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today I'm very, very pleased to welcome Olivia Thomas out of North Carolina. Olivia has been a nurse since 2016, and she says she's cared for patients of all ages, from infancy to geriatric populations, and in a variety of settings, which include ER and trauma and radiology and IV hydration and wellness. She's a certified legal nurse consultant, and she works with attorney clients on legal cases involving medical issues. She is an entrepreneur. She started her own business, Thomas Nursing Consultation, and she says she's passionate about medical record review and investigating the cases to bring light to the situation at hand. She's a Christian, a wife, a mother, and a friend to those around her. So, Olivia, thank you so very much for being here.
Yes, thank you. Thank you so much.
It's my pleasure. It's my pleasure. And as I looked at your bio, you said you are passionate about medical record review and investigating stuff. That's kind of like
Hmm.
that's a nurse. So we're such curious people. We
Yeah.
want to know. We want to
Yeah.
know.
Oh, yeah. Absolutely. Yeah, it's
So
kind of funny going into nursing, you don't think that you're going to be an investigator, but every nurse is,
it's what
with each patient. Yeah,
yeah, you gotta get down to the nitty-gritty. What's going on here?
exactly. Yeah.
But what brought you to this, Olivia?
What brought me
Into
to what?
nursing?
Nursing or legal nurse
Yeah,
consulting? All of
nursing.
it? Nursing. Okay. So I'm actually the first in my family. I'm the first and I'm the only in my family, which is different. I feel like a lot of nurses, most
Yeah.
nurses I know anyway,
Hmm.
they come from a family of nurses. Um, I've always been interested in science. I would say writing was more so my strong suit than science, but I've always been interested in it anyway. And
Hmm.
the generic answer everyone wants to say is, I want to help people, which it's an appropriate answer, I think. I want to help people.
Hmm.
So, I just felt called to serving others in a way that it's in some of the best and some of the worst moments. And depending on where you're at and what's going on at the time, you can bring that peace,
Yeah.
to the situation. So I love
Yeah.
it's a privilege to be able to do that.
Indeed it is. Indeed it is. And you just use some words that many nurses use when I speak to them, and they say, I felt called.
Yeah,
I felt called.
yeah,
As they say, many are called, few are chosen. So,
I love
but
that.
anyway, so all right, so you wanted to do this, you wanted to help. You're striking out on a path that's not really your family path. What were
Mhm.
the challenges for you?
Well, I feel like COVID was a big challenge. I actually back it up for a second. I have a little bit more of a unique challenge in that my husband, he's a veteran now, but he was in the army, and we moved overseas. We went to Germany. I was only there for a year because he got a lateral, well, I guess not a promotion, but essentially it seems as such. He got a job here that was better for him than the
Hmm.
job that was there. So we weren't there very long, but I did not work as a nurse over there. I kept active and, keeping my
Yeah.
certifications up and everything. This was before becoming a legal nurse consultant. So that was a kind of a hiccup in and of itself, or it felt like
Hmm.
it was career wise, just in that I put a little pause, put a pin in it, but I was
Yeah.
still, I didn't let anything go. I didn't let anything slip. And you bounce back, I jumped right back in. I wasn't gone that long. In the
So
grand scheme of
you
things,
weren't
I was,
actively working, but you were paying attention.
yeah, yeah. So,
Okay.
so got
Okay.
back into it, and of course, I got back into it just smack into COVID,
COVID.
and
Yeah.
they made the hospital, like administration, everybody made it very hard to work during that time frame. Everybody got burnt out, all the
Yeah.
mandate issues, just it was just a kind of a
Yeah.
disaster, you know. Um,
Yes.
so when it's a
Yep.
calling, it's
Yeah,
you know,
indeed.
and I don't
Indeed.
blame anyone who stepped away from the hospital, but that was kind of what I did was look into the legal nurse consulting while I was working in the hospital because I'm still working now, but I'm not in the hospital now. The IV hydration and wellness place I work at is it's a like a clinic, it's its own business, but it's not a
Yeah.
hospital anymore.
Yeah.
So, working on my certification, I was still working in the hospital at the time, but I also was just kind of in the back of my mind, like, things are getting a little bit heated right now. Let me just see what
Yeah.
other avenues are out there,
Yeah.
and let's see what I can do to be creative because it's just a
Yeah.
completely different outlet. It's not a common nursing profession or
Mhm, mhm,
specialty, but I think
mhm,
it's
mhm.
really interesting for sure.
Yeah, yeah, it is interesting. It gives you a little bit of insight into, especially when you are working. And as I say these days, we work very defensively. We practice, for the most part, defensive nursing. Um, and it gives you an insight into how to best take care of your patient while protecting yourself.
Mm. Yeah. Oh, yeah. And what's in that chart and what's not in that chart,
Yeah.
That's a big one right there. Yeah.
Indeed, indeed, indeed. But you tell me now you're into IV hydration.
Mm-mm.
Why?
I love the just difference that it is from the hospital. It's such a wellness oriented situation. It's not about treating sick people. It's about staying healthy and not getting sick.
Exactly.
That's why I love it. It's great. We should do more like this, more of this, more things
That
like
kind of
this. Like, oh my gosh, that's what nursing I think needs to shift to in the future.
exactly,
More focused
exactly.
about health, not about treating the sick. Obviously, we have to treat the sick, but what can we
Yes,
do to avoid being sick?
the stuff.
You know?
Yes, 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 yes. That is the whole reason I think I asked you why.
Yeah.
Because, as you just so very eloquently articulated, it is a wellness thing. And that's
Yes.
really where we should be heading,
Oh my gosh, yes.
doing well. Mhm.
So to say I'm passionate about that too. It's important. It
I
matters. And I
get
want to be
that.
healthy. So I want others to be healthy too.
Yes, I get that. But do you think though, um, is this a what is the word I'm looking for? Is this a well-known thing? Do you think our population is taking advantage of this? The
Mm.
way we take advantage of being sick. We begin to think it's normal actually to be sick.
Yeah. Yeah. It seems like it. It's normal to, oh, I don't have anything wrong, but I'm taking these medications. Like that's normal.
Yeah.
And
Yeah,
to not
or
question
or
things.
yeah, or we look at people who are not taking medications, or we call it, why not?
Hmm.
You know?
Yeah. Yeah. It's just
Um,
normal to be on medication.
yeah,
And it can
yeah.
be good, obviously. It's good when it's needed, but there's a lot more.
It
I
has
mean,
its
you know that.
place. It has its place, but we really need to do more of what you're doing and do channel a lot of our efforts into keeping the population well.
Yeah. Hmm.
Yeah. So, what do you see? What are people's reactions when you tell them you're a legal nurse consultant?
Sometimes they're a little confused at first, not knowing, sometimes they're like, oh, are you able to give like legal advice? And that's not it. Like, no, I'm not an attorney. I think that'd be kind of interesting. But I am not an attorney. So they don't necessarily know what it is, but I just dive into it and explain, essentially what I'm doing is,
Yeah,
reviewing charts and seeing what needs to be done from a nurse's perspective about a legal situation, if that makes sense. I'm able to work with attorneys and collaborate, which is really cool because attorneys, although they do know a lot of medical issues, they don't know everything in the chart from a nurse's perspective. They don't
exactly.
know what the standard of care is all the time in any given situation or like what the nurse should or shouldn't do they know a lot of it, they know a
Yeah,
lot, but there are some things where it whether they're very well seasoned or they've just started, like they're not going to know because they weren't in the hospital and they weren't in the place of the nurse, they weren't in their shoes. So basically I'm trying to bridge the gap. That's what
yeah,
my goal is.
yeah, 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 yeah. it really is one thing to know the medical jargon and stuff like that, but it's another thing to understand how you maneuver within that framework.
Yes. Oh, yes.
Yeah,
Absolutely. Yeah.
yeah, absolutely. What do you think you'd like to see change about nursing, if anything?
Oh gosh, so much. There's so much that needs to be. I love it, but it's a beast. I mean, I think you probably would agree. It's a beast. I wish that there were, I do really love to see when anything organization wise or um, just anything that's medical, if it's headed up by a nurse in some capacity. I love like if I were to go back to school, for example, which like to get like a master's degree or anything higher, I would be interested in, and I'm not planning on it right now, but if I were, I would be interested in the research aspect, like the nursing research. I just I want to shift our focus, administration, hospital administration. I know there's got to be hurdles and I don't understand it from their perspective, but there is just such a divide between hospital administration and nursing. Um, I don't know how to get to the root of the problem, but I do think that we need more nurse-led organizations and
Indeed, we do.
I don't know.
Indeed, we do. And I think that it is up to us. No one's going to drag us into this light.
Yeah.
It is up to us, and it is up to us to make our voices heard. Because, as you just talked about, hospital administration and stuff like that. Well, hospital administration is responsible for the whole big picture,
Mhm.
despite the fact that we are the biggest part of that big picture. If you looked at a pie
Yes.
chart, we'd be
Yeah.
up there. But um, that administration comes from very often a business perspective, a totally different. They're not clinicians, most of them.
Yes. Right.
And so it is very difficult to put yourself in the place of a clinician if you're not a clinician.
Hmm.
And, I think that it's up to us to move that, make a little space for ourselves. And so we
Yeah.
belong here because, we're trying to create an industry or an environment that we are the ones who are administering it.
Yeah.
God,
I feel like that's a good idea. Like, why I don't know how to make it happen
I don't
everywhere,
know
but I
how,
wish
I
that.
don't know. I don't know if I know how, but I feel like, honestly, I feel like if enough of us talk about it, somehow at some point we're gonna reach critical mass
Yeah.
and it will
Yes. That's
happen.
why I love that you're doing this. That's why I love you're getting nurses' voices out there. That's too cool.
Let's talk. Let's talk. What do you think, though, that it'll look like? I keep asking and I keep wondering what it's going to look like in about 10 years or so, this nursing thing,
Mhm.
because even not even taking it COVID into account, even leaving COVID out of the picture, nursing today doesn't look quite the same as it did 10 years ago.
Mhm.
So what do you think is going to look like in another 10 years?
Uh, it's going to depend, I guess, on how we handle bedside nursing. I even when I was in school, I felt a big push of, oh, you're good at this. You need to go get your master's, you need to, and they were telling other people this too. It's not just me, just get away from the bedside before you even start almost.
Mhm,
I feel
mhm,
like we've got to
mm.
focus on our bedside nurses more, and but it's hard. It's hard because a lot of people don't want to stay at the bedside because it's a lot.
It is a lot. It is a lot, but that's one of the changes that I think I would like to see come about is that make make it just so that people actually want to stay at the bed.
Hmm.
Not that people have to, because I am a big proponent of nurses being everywhere,
Yeah,
because we
same.
can. But,
Hmm.
nurses who want to stay at the bedside because that's what they got into it for should not feel so overburdened.
No, there needs to be room for more growth there too.
Yes.
There's got to be more
Yes.
growth at the bedside, not
Yeah.
just seniority. I don't know how that would
Yeah.
come along, but
Yes. But and there's in addition to that, we have all this technology, that's impacting the way we do everything. Um,
hmm.
so I foresee in another 10 years or so. and a lot of technological advances in healthcare, within the healthcare field, um, which may be cool. It may be a little unsettling for some of us, people
I
like
know,
me who
yeah.
are way up there in our ages. But I think in a way it probably would be cool. So you've done so much. 2016 to 2024, you've done quite a
Yeah.
bit in that time. What do you think of, what do you think is your greatest achievement so far?
Hmm. I don't know. Because when I think about great achievements, I don't necessarily think about nursing. I think more so like family life than I do.
Mm, okay.
Because while starting the legal nurse consulting business, I mean, I was off to a very, very slow start, just in the fact that I have a toddler now.
Hmm.
I can remember being very, very, very pregnant when I went to go get my business bank account set up. And it's just like, rolled right into that season. So that was just, and it overtook everything in the best way. And that's not really being a nurse, but okay, I'm going to come up with my answer here in the middle of this. I love that nurses learn no matter what situation they're in, like no matter the specialty, we learn and we grow. And it just is a ever continuing process. We're always learning and growing. But you can apply that to life. You
Yeah.
know,
Yeah.
what a blessing it's been to be not just a mother, but a nurse and a mother and a wife,
Mhm.
and not just a wife, a nurse as well. There are I mean, it can be a curse too. Don't get me wrong, because you can you can be a little overwhelmed by the things that you see
Yeah.
and worry about in the future. But it can be really helpful.
Yeah.
Yes, those pediatrician visits could have been scariest thing in the world, but it's like, oh, I'm a nurse, so I can keep my mouth
I've
shut for a
got
little while
this.
anyway, not let them know, but at least I understand what I'm dealing with a little bit.
Yeah. Yeah.
So
Yeah.
it's a blessing. It's a blessing
In
that you can take this profession and apply it to your life.
your life. Typically, I ask that question because I feel, honestly, that as nurses, and particularly as women, mothers, whatever, we tend to go along doing things without actually giving ourselves much credit for what we have done or what we have achieved. We just go ahead and think,
Yeah,
well,
you just do it.
I did it. I just, yeah, exactly.
Yeah.
you know. And I think that sometimes we need to stop and say, wait a minute, I did do this.
Yeah. Yeah.
Yeah.
And
It's like,
sticking with it, and sticking
mhm,
sticking with it when there
that's,
are some hard
yeah,
situations, not even COVID, like there are other situations in the hospital. It can be hard to stick with it at times, depending on your circumstances, depending on, the nurse to patient ratio and what's your administration like. It could be a lot. You never
yeah,
know.
it is hard. It could be hard every single day. It hard every single shift.
Mhm.
It's hard to go from a room where someone is you know is in dire straits. Things are not going well. And you got even a little bit emotional and involved in this. And then it's hard to go from that room to another room where someone just got good news.
Yeah.
And how did you change your whole being really in the space of time that it took you? Because you just cannot take this atmosphere
Yeah.
into this. Um, and that can be a bit of a struggle at times.
Yeah. Have to really stay objective.
Yeah, yeah. Mm-hmm.
But it's easy depending on what's happening, especially back in the ER days. You really, really run into some tragedy
It
there.
just,
And
yeah, yeah, yeah,
when it gets past the point of being objective when you start thinking about their family. When you see little pieces, like you see someone who's super duper sick, they're dying, and you see their wedding ring, and you
yeah,
learn that they
yeah,
have
exactly.
two young children, and that's where it gets hard to stay
Yeah,
objective.
yeah, 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 yeah. It can be hard at times. But we talked about, as talking about those things and staying objective and taking care of, do for self-care. So what does it mean to you, self-care?
Hmm. I'm not very good. I'm sure I'm not the only nurse like that. Not very good at like just sitting still and resting. But um, self-care for me, ah, hobbies. church, you know. I think that just being refreshed in the Lord and going to church and worshiping is a huge version of self-care we sometimes take for granted. That's an opportunity to get to do that. That's a blessing to get to do that.
Mhm,
Then
mhm,
also
mhm.
just finding different hobbies, you know, doing things because I want to, not because I have to, you know.
Yeah, yeah. I get that. I get that. For me, self-care is being outside on any level.
Yeah, it's
On
nice.
any level, whether I'm walking, which is something I like to do, or
Yeah,
I'm gardening, which is something I like to do. But if I'm outside doing absolutely nothing, I am good.
yeah, yeah. That's wonderful. Outside's
Yeah.
wonderful. I agree.
So what would you say if you could tell me in one word what you believe to be the most essential quality of a nurse? What would that word be?
Hmm. There's so many words. There's so many. Ugh.
Yeah,
There are so many.
I
Um,
will take two.
um, you know, being an advocate, I
Mhm.
think advocate is the
Yeah.
strongest word because these people depend on us. There are just times where, you know, you learn in nursing school about patient rights and informed consent and all of that. But then you kind of just, you know, gloss through it. It's just more of the stuff you're learning. And it's, you know, when it becomes real for you, when you're working with a patient who doesn't have the ability to advocate for themselves, when they have family that
Yeah.
maybe they're a detriment in some way, or even if they're not, you know, they're there and they don't know.
They
Like
just don't
they
know.
need us. Yeah, they need us. There's yeah, that's what I'm most passionate about with nursing is being an advocate.
Yeah. 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 And there is a reason I ask that question. One of the reasons is that I really want us to think about it.
Yeah.
Um, what is it that we bring to this table as a nurse? What real qualities, not just as an advocate, but also because I began to recognize nurses without anybody telling me they're a nurse.
Yeah.
We kind of like move and behave a certain way, and
Yeah. Oh, I
I
love
was
that.
kind of
That is too cool.
yeah. So, I thought, well, okay, are we seeing, is everybody seeing this? Are all nurses seeing this? What am I
Yeah.
seeing? But
No,
after
that's
a while,
neat.
you
I'm
get
gonna
to,
start looking through that lens and try and pick out people like that. That's cool.
you can
Like
see
a game.
the way we move when you walk into a room, and already you think to yourself, oh, this person's a nurse, because you can see they have already read the room, and in their head, the plans are being made.
Yeah, yeah, it makes sense.
This is like that.
Love that.
Nurses are like that. And I love it. I really do. I
Yeah,
smile to myself, or, um, very often, even after all these years, I would say something and say to my husband, did you see such and such? He goes, how could you see that? And I go, I'm a nurse.
yeah.
I
You're
did.
looking when you don't even realize you're looking.
Yeah.
You know, it's funny. For me, that started when I was a teenager because I was a lifeguard. So now I can't
Yeah.
go to a pool without looking. I'm always looking. I don't mean
Yeah.
to, but I just do. It's
Yeah.
the same
Yeah.
thing.
Lastly, but not, what advice do you think you'd give someone who wants to be a nurse? What would you tell them?
I so and if there are people that I know if they watch this later, they're gonna laugh. But ask questions, ask all the questions and never go asking them. Oh my goodness, I probably became a little bit annoying in my last hospital job, just asking all the questions. I just wanted to be a sponge. But also like I would think of questions that weren't necessarily asked yet. And it made me know more what I needed to know and how to grow forward with it. Oh my goodness, though, it just matters that you ask. You know, there are so many different cultures of
Yeah.
nurses who,
Mhm.
you know, they may not be brought up to ask questions, but
Mhm.
it
Mhm.
matters. And it doesn't matter who you're asking to. You can bug that doctor, ask those questions, make them
Yes.
think, why are they doing what they're doing? You know, ask them. And if they're supposed to, great, but at least call them. At least call them out and see. Ask away. Ask the senior nurses. Ask the ones that have been in it longer than you. See what you can learn from them because continuing education is great. Classes are great. Certifications are great. That's good and it's important and it's needed. But what can you gather from other nurses around you and ask those questions? Even if you're being annoying, ask those questions
Mm-hmm.
and
Mm-hmm.
learn. Like, just that's a great way, I think, to keep learning. And that's it.
I agree with you. I've always maintained that you cannot be a good nurse if you're not curious.
Yeah.
I think
I mean, I felt
curiosity.
annoying. I felt like a very annoying person, and I probably was, but I think that it's good. I think it's good to ask those questions.
Has anybody ever tried to flip the switch on you and ask you a lot of questions?
No. I mean, sometimes, but not. No.
Yeah,
Hey, but they're
yeah,
they're they're critical thinking questions. They're not why. They're
yeah,
not toddler
exactly.
questions.
Olivia, thank you so very much for this conversation. It's been
Thank
swell.
you.
Any last things you'd like to say?
I mean, I'm glad I made you laugh.
You
I
did.
love it. I think it's
Well, thank
wonderful. I think
you.
that's beautiful.
Thank you so very, very much for this. I
Yes,
appreciate
thank
it more than you
you.
know.
Yes, I appreciate the opportunity too so much.